right, great. So in this presentation, we are going to look at interpersonal communication, and then after that, we'll look at how to tailor or how to craft health messages. So we are going to have two sessions, and this is basically the first one on interpersonal communication. So in this session, we should be able to cover the definition of interpersonal health communication, the key concepts and theories of interpersonal communication, and also be able to apply interpersonal health communication skills and strategies to different health contexts and scenarios. And you should also be able to evaluate and analyze health, interpersonal health communication processes and outcomes in relation to health goals and challenges. So those are the objectives of this presentation. So when we talk about interpersonal health communication, we refer to that communication that is person to person communication about health and disease. That means that you're basically talking to one individual about a health matter, okay, that is actually affecting them. So that is basically what we refer to as interpersonal health communication. So it can be communication that is between a patient and a health provider. Okay, it can be a nurse, it can be a healthcare manager, it can be a public health professional. Okay, who is talking to a client. Okay, so this patient provider communication is very key. Okay, and it gives us a lot of insights on how health communication or patient provider communication is very key. And actually, Hippocrates believed that the recovery of a patient lies more on the patient's trust and contentment with the physician. Okay, that means that the patient, if the patient has trust for the physician, then their recovery is likely to happen. Okay, so that means that the communication between a physician or a health provider with a client or a patient is very, very key. And then another statement also by Balint, 1955, says that the doctor is the most used and effective drug. Okay, that means that the doctor, as a person who is interacting with the patient, is actually therapeutic. Okay, it's therapeutic in nature. That means that they contribute to healing or improving health outcomes. But generally, as healthcare managers or even as health professionals who provide services directly to patients, proper communication is very important, especially it leads us into adherence to treatment. That means that if you share the decision-making process with the patient, then they'll be able to understand the nature of treatment that you're going to receive, and what are the likely benefits and side effects, and they'll be able to comply. Okay, and compliance is very, very important in chronic disease management. Okay, but generally, as a healthcare manager, you will see that the proper communication with patients or clients is very important, because the patients will trust the health facility and the health professionals more, and they will be able to rate the health services higher. And then when you have this actually moving on well, that means as a health facility, you're most likely going to have better health outcomes because of the communication that happen between physicians and their patients, or nurses and the patients. So a patient-provider communication is aimed at making sure that the patient actually understands their condition and that they can actually trust the health professionals in providing care. Okay, and the patients themselves should be able to be involved in decision making about their care, and therefore uh, patients are assured of their safety, and most likely they will comply with the treatment that they are actually receiving. Okay, providers on the other end should be able to address the emotional and psychological needs of the patients. Even with the importance of this communication, there are scenarios where this communication is not actually very effective. Perhaps you don't understand the local language, or there are cultural differences, or maybe the patient cannot understand health information, however much you have tried to use the simplest terms possible. And that's an issue to do with the health literacy. And then if you have a lot of patients on the line waiting for you, you may not have enough time to be explaining to them what their disease is and what are the likely modalities of treatment, and how they can be involved in making sure that they decide on the treatment modalities. Okay, and then also sometimes you can be overwhelmed as a physician or as a health provider, and you cannot ably communicate to them, or they cannot ably listen to you because of the diagnosis that is made and the prognosis that they may actually be aware of. Okay, so emotional distress, fear, anxiety issues, these are not good for effective communication. So that means that as a provider, you need to make sure that the patient is actually in a stable emotional state to be able to discuss some of these difficult topics. Topics like end of life, topics like liver transplant or organ transplant, and things like that. These are difficult topics. And if someone is distressed or is stressed, they may not really pay a lot of attention in this conversation. So communication in healthcare can happen at different levels. Basically, as the basic level, which is basically providing information to the patient. If you're going to give them an injection, providing them information on what injection they are going to receive, and what will happen when they receive this injection. And then the next level is the emotional level, which is addressing the patient's emotions and fears, and also concerns. And then partnership level is when you want to make sure that you involve the patient in decision making about their treatment plan. And then the last one, which is educational level, which is teaching the patient about their condition, self-care, and treatment options. So effective communication can happen if you actively listen to the verbal and non-verbal cues, such that they can actually the patient can be in position to uh, communicate to you or talk to you. And then empathy, which is understanding and even acknowledging the patient's feelings and outcomes and emotions. I mean, make sure that your communication uses very clear language, free of jargons, that is technical terms. In order, you don't have to use a lot of technical terms to convey information. Make sure that you don't project a judgmental attitude, and use open-ended questions to explore uh, uh, what patients feel, and that they should be in position to actually express themselves. And then the other thing is that you may need to use health education materials. This can be posters that are put on the walls, that are hanging around, such that you use visual and written content on these posters, such that they can be able to read for themselves and interpret. So the key things in health communication or in communication between a provider and a patient, you need to know what you're going to communicate about, okay? And the information that you're going to communicate, how is it going to flow? Certain information may overwhelm the patient or the client. So you need to have control on what information you're releasing. Okay, this is very, very, very important. But it's also very important for you to acknowledge that things have actually changed and that the communication between a provider and a client, um, there's a shift. There's a shift. It is no longer about the the physician knowing a lot and the patient actually knowing less. Because of technology, patients or clients have uh, have access to information that 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 relates to what is actually affecting them. And also the other issue is we don't there's a power shift. Okay, it is no longer that the doctor actually knows it all. It is now actually what we call a shared responsibility, where it's about sharing information and then coming up with the what is best, what is the best course of action, um, given the input of the patient also. So this is very important. It's no longer about uh, the doctor knowing a lot and making their own decision and then imposing those decisions on the patients. It's about shared decision making. Okay, so that is also an important aspect. And then another aspect is what you call the epidemiological transition, a shift from cure based to care focused medical approaches. It is very important that we empower patients to be able to take care of themselves. It's no longer that it has to be the health provider to do each and everything on the patient. So self-management is also very, very, very important, especially in chronic conditions. So these changes actually influence the way in which we communicate with patients. So that marks the end of uh, the first session of this lecture, which has been basically focusing on the interpersonal communication between uh, providers and patients. If you have no other questions, then we can move to the subsequent